I'm going to show you today how I treat someone with plantar fasciitis or heel pain or calf pain or a sprained ankle. So what I've devised is a combination of different treatments to help ease up this pain and this problem. So the foot has three arches. There's the lateral arch, the transverse arch, and the medial arch. So we need to get those working so that that heel pain in the plantar fasciitis can resolve itself, stop that inflammation process, and help the muscles become strong and stretched out like they're meant to move the muscles and the bones. So now some of the techniques that I have put together that I have learned over the years and have been certified in is Graston technique. And how I do that is with the tools. Another thing that I do is if the patient is required to help the bottom of the feet develop the three arches again, I can fit them for orthotics that will help correct the arches in the feet. So I'm going to start with the Graston, and I'm going to start, we've already warmed up the area with a hot pack, and now we're going to ask you to move your foot up and down like that. And we're basically gently lifting up and stretching out that fascia and any adhesions that stop the skin, the fascia, and the muscles from gliding over each other. And I'll do that to the patient's tolerance, always. And now what I want you to do is do clockwise as far as you're able to. And a lot of times I notice people, when they move their joints, I can see the stiffness before, and then after it's changing, the stiffness goes away and they have greater range of motion. Now if you can do counterclockwise, and I'm going to change my direction so we get all of the muscle fibers and the adhesive fibers and the scar tissue elongated as much as we can do on that day. And then moving on to the foot, I'm going to go only to the depth of what the patient can tolerate. And we're just moving the skin, gliding the skin and the fascia over each other and the muscles. And even people who are really tender and sore, I'm not going to go that deep with them. I'm actually going to go pretty much slower than this. And if they're super ticklish, I'm going to find other ways that will desensitize the foot. And you could see how I'm trying to elongate the fibers to get her foot nice and long. And then as the treatment visits go by and the patient can tolerate a little bit more, I will get in here a little bit deeper to open up these little bones in the foot, the really long bones and all the fascia in between, so that each arch of the foot, lateral, transverse, and medial arch, can work like springs or shock absorbers when we walk. So I gently go into that. And let's say a person has a sprained ankle, then I would make sure I would check in with how delicate that sprained ankle is to what their tolerance is, and flush that extra blood and inflammation out of that area. Then after each treatment, we ice the area. And then when the patient goes home, they do their exercises to help support this treatment. Now we're going to go into the stretching or lengthening part. So I just take the joint to as far as it's able to go and comfortable for the patient. Now I want you to take a breath in, and then as you exhale, gently push your foot into my knee. And then let go, and then we stretch it. Take another breath in and push. And then let go and stretch. And then I do the same thing to the foot. Take a breath in, and then I want you to curl your toes up into my palm, up towards the ceiling. And then let go and stretch. Take a breath in and push up. And then let go and stretch gently. And then I'll go in and make sure that the pelvis, the knee, the ankle, and the foot bones are all aligned.